Hi, everyone. I have Dr. Sneha Kishore coming on. We're going to talk about lifestyle medicine. She is the founder of Argow Health. You can find her at argowhealth.com, and she's going to talk to us all about her lifestyle medicine tips. She is an internal medicine doctor. She practices locally. She also does internal medicine, and she's going to join us right now, this second. And we'll just have a quick chat about lifestyle medicine, and she's going to share some of her healthful, get it, healthful and helpful tips. Hi, Sneha.
Good morning,
Good
everyone.
morning. Thanks for joining us. So tell us about yourself.
I'm a practicing internal medicine doctor for about 11 years out of residency training. And about 6 years ago, I started to get a little bit of angst, if you will, that, I'm doing a lot for patients at the end stage of their disease in the hospital, but what about in the early stages? And I started to learn more about lifestyle medicine, its practices and things like that. And I decided that I need to do this. And I felt like this is where, I should be. This is the space that I want to be in to help people prevent a lot of these diseases and put them in the hospital later on. And so I started Argo Health this year.
And that name, Argo, where did that name come from?
So it's actually the combination of the first few letters of my children's names. And I always felt that it had a very unique ring, and I could use their names in it. And, they're, of course, my life. And I felt, their name, Argo, and health would be perfect unison because their health is everything to me. And same with my clients, myself, my family. So that's where it came from.
So for people who don't know what lifestyle medicine is, what is lifestyle medicine?
So lifestyle medicine, I get asked that a lot, and they say, is it naturopathic medicine or integrative medicine or functional medicine? And I'm like, no, close, but not really. It's actually an offshoot, I would say, of internal medicine. It's the evidence-based practice of using, making lifestyle changes to affect our chronic diseases like obesity, hypertension, heart disease, diabetes, and such. So it uses predominantly a plant-based diet, along with physical activity, reducing stress, connectivity, social connectedness, purposefulness, avoidance of risky substances, and adequate sleep to promote and prevent sometimes chronic disease.
So you just basically said everything that I tell my patients to improve embryo quality,
Yeah,
both egg and sperm. Literally,
absolutely.
like that's the list that I run through. So that's really cool that you're trying to prevent the effects of chronic medical diseases down the road, and I'm trying to prevent infertility, and the approach is very, very similar.
Yep.
So, one of the things a lot of patients deal with, especially when you've been hopped up on drugs forever, is just that weight gain that can just stack over time.
Yeah.
What is your approach to helping patients lose weight?
Oh, a lot of approaches. Really depends on the individual and their trigger points. I have some clients say that, the stress eating gets them. I have others who just don't have the physical activity to get them moving and get some of that weight off. It's really tailored to the individual and what are their trigger points. And sometimes there can be multiple trigger points. And yes, of course, hormones can play a big role in eating and weight gain. So a lot of, multidisciplinary approach, so to speak. Are you getting adequate sleep? Are you mindful when eating? Just eating without thinking of what you're doing can be harmful and pack on extra calories and pounds that we don't need. Are you eating the right foods? A lot of processed foods that are packaged as healthy foods, or are you eating whole foods? And are they predominantly plant-based? Because, animal products versus plant products, they're big different profile. Animal products can lead to more chronic low-grade inflammation, whereas plant foods have been shown to reduce systemic inflammation. So it's really a tailored approach to what the individual needs and what their trigger points are to get them to where they need to be.
Right. And we're hearing a lot about different diet fads. I mean, all the time, the South Beach diet, the Atkins diet. And now I get a lot of questions about the keto diet. What are your thoughts on the keto diet?
Very interesting thoughts. I think a whole food plant-based keto diet has a place in therapy, but it's still being researched. I don't think we have enough data to say yes, everyone should go on it and be on it long term. First of all, ketosis is a state of stress for the body, right? We are in ketosis only when we're in a state of stress or starvation. Now, do we want to put ourselves in a state of chronic stress, to lose weight? I'm not sure that that's, going to be the best way and the most sustainable way. And it's limiting, yes, it's limiting refined carbohydrates, but it's also limiting a lot of complex carbohydrates. And I can really attest to this because I tried a whole food plant-based keto diet for about a week just to give it a try and just to know what that means and what I can and cannot eat. And for me, I felt it too restrictive. And it took away a lot of the foods that I really enjoy eating that are good for me, like, bananas and peaches and pears and, such. So I felt that, if I can get the same health and weight loss and health benefits, eating healthy, good, complex carbohydrates in conjunction with other, macronutrients, protein and healthy fats, then why would I not want to do that, and limit myself on just high fatty foods? Now, in a traditional keto diet, the problem is that you're taking in a lot of animal products, and that can be very, very harmful to the body. Overload of protein for the kidneys, increased cancer risk with some of the processed meats, which is classified as a class 1 carcinogen. So these can be very, dangerous, and also basic increased saturated fat, which is definitely something that we don't want, especially in our high risk population with heart disease already on their list. So I think keto diet may have a small space as a whole food plant-based. The jury's still out on that though, but traditional keto diet, I don't think is something that I would recommend.
And what advice do you have for women who are already that sounded like word scramble, vegetarian, especially when they're planning a pregnancy or in pregnancy? Do you have any special tips for that population?
Yes. So, pregnancy is a time of great change for the woman's body. And, eating whole foods is very important, not only for their own body, but also for the developing fetus. It's shown that what the mother eats during pregnancy helps to colonize the placental microbiome, and hence, later on, the baby's gut microbiome, which is very important for, overall metabolic health and, disease reduction. So it's really important to go towards whole plant foods anytime in life, but especially in pregnancy, to keep a healthy body weight, to keep healthy, mind, and to keep the pregnancy, moving smoothly without complications. Sorry.
No, you go ahead.
And in addition, I recommend, physical activity. Body's going through a ton of changes. Keep the body physically active. There's no need to really slow down unless medically indicated. Keep moving, move as much as you can until as long as you can. Again, if it's safe to do so, helps to keep, the blues away, so to speak, and helps to get back to a healthy post-pregnancy weight for the mom as well. Sleep, you're not going to get it after the baby, so you might as well get it in now. Get your 7 to 9 hours. There's a lot of studies that have shown that 7 to 9 hours is your sweet spot. Less than 7, more than 9, can lead to decreased health. So get that sleep in.
And then what about processed foods? I mean, I often tell my patients avoid processed foods, but truly, what are the dangers of eating processed foods when trying to get pregnant or when pregnant?
Yeah, so processed foods is a great one because they can be packaged to mimic healthy foods. And when you really look at their ingredient list, a lot of it is not really food-like. They're really chemicals put together that is, supposed to make you think that it's food. The one of the biggest risks of processed foods is the introduction of environmental toxins into them. And that can be really harmful for a woman's fertility and for overall health and well-being. And it can increase risk of a lot of diseases, including cancer, which we definitely don't want. So processed foods should really be zero in the diet, if at all possible. And, you know, they may be convenient, but they're really not. In the long term, they're just going to lead to a lot of chronic disease, and we really should eliminate them.
So I have a protein bar every single morning. It is extremely processed. Is that bad?
I would avoid the protein bar, and rather than that, you know, maybe create your own with, you know, ingredients like oats and nut butter, some dates for sweetness, some seeds, kind of throw it all in a food processor, blend it together and put it in a tray pan, and, you know, bake it off for a few minutes, and you've got a bar. You can even drizzle that with some dark chocolate and make it a treat, you know, make them into squares. So, you know, or make it into balls, energy balls.
You just said balls. That's what you get when you come on my show. Sorry.
Yeah, you know, just, you know, energy balls, whichever shape you want them to be, you know, bar, or, you know, energy ball. So, you know, it's really, that was one of my, you know, issues as well. I would go towards a healthy granola bar, but then when you really turn it around and look at it, it's really nothing really healthy about it. And I'm like, why am I taking this in? It's just a lot of processed stuff put together. I can do a better job, you know, making it at home with whole ingredients. So, yeah, definitely, if you can avoid it, avoid the protein bar.
And the one thing a lot of fertility patients report to me, and I mean, it bothers me when people don't feel good about their bodies, is they talk about the amount of weight that they gain during fertility treatment. And I always tell them there's no calories in the medications. Duh. I mean, but the medications definitely make you change how you see food, affect your metabolism, how much you eat, the types of choices you make. So what kind of tips do you have for my patients about how to be more mindful when they're eating?
Yeah. Just sitting down and stopping, really, sit down, chew your food. My family will tell you I'm guilty of this. Like, number one problem with me is I don't, you know, I'm like always on the go, and I have to actively tell myself, stop, sit down, look at your plate, you know, look at the beautiful colors on it, and enjoy it, you know. And so a lot of times I will literally just sit there and count, you know, my chews to 10 and then swallow. And it's really therapeutic because I actually taste my food. That's just one simple way that we can all, pregnant or not, on fertility treatments or not, kind of reduce our unnecessary overeating and calorie intake, is by just slowing down, enjoying what we're eating, appreciating and acknowledging what we're eating, so that we get to that 20 minutes or so where our brain tells us, okay, you're full now. You know, the satiety center is happy, it's good to go, and you can move on with your day. So that would be my number one tip, is just to slow down.
So my approach of how fast can I eat this is probably not a good one. Okay, good to know. And then how about coping with anxiety and depression? I mean, most people are right now a little bit anxious, if not a lot, because of COVID. And then add that being a fertility patient, your anxiety is now up to here, especially if you're dealing with an abnormal pregnancy or a negative pregnancy test. What helpful tips do you have for patients dealing with anxiety and depression right now?
Yes. So lifestyle, you know, factors really can help cope with, you know, anxiety, depression, mental health issues. So one is exercise. Exercise is a great way to help the body feel better. And, it's as effective as cognitive behavioral therapy, really known to show to, reduce the signs of depression and anxiety. So exercise, and maybe even take a buddy with you. That leads me to number 2, which is connectedness, social connection, being close to people and interacting with people. I know it's hard now in this pandemic, but still, FaceTime, Zoom, your family, get to know them a little bit more. I think, in the hustle and bustle of daily life, I'm finding so many times my kids say something and it's ridiculously funny. And I'm like, when did you start growing up and talking like this? Right. So I'm really noticing their personality and really noticing who they are becoming, and taking time to get those kind of connections. Also taking time for yourself and getting connected to who am I, what do I want out of life? What do I want to do? And where do I want to go? What legacy do I want to leave? I know these are seem really, intangible things, but, it's really important to, just sit and ponder for some time, and kind of understand that we are, one being and a part of a big, bigger circle in life. And the other one is nutrition. Nutrition is a big factor. Fried foods, sugary foods have a big risk of depression and anxiety, whereas plant-based foods show the opposite. They reduce anxiety and depression. And there's studies that show in pregnant women, low omega-3 fatty acids can actually increase maternal depression, and a 4-month trial of, supplementing that helped. So food is really important, and it is our medicine. It is our medicine with no side effects, so it's an easy one to do. And sleep. Please don't neglect sleep. Sleep is so important. It is a time where we have the chance to repair and restore our body. And, our deep sleep helps to, deal with fears in our life. It helps to package them and make them, process them so that we can deal with them in a more positive light the next day. So sleep is something that really should not be ignored by anybody. So that's a big one as well.
Right. Huge. I mean, what you mentioned, it's funny. We kind of practice in a similar way. You're focusing on one part of medicine and I'm focusing on the fertility part. And I also ask patients, what do you want? What is it going to take to get what you want? And are you willing to do it? And I ask patients to ponder those things all the time, but especially when they first start their journey with me. And so it's nice to know that you do those things too. And then all my patients who want help with their plant-based diet and anti-inflammatory diet, they're coming all to you. Okay. So where can patients find you? Where can they find you?
So on Instagram, I'm at Argow Health, and my website is www.argowhealth.com.
And do you have any last minute tips? Because you're an internal medicine expert. And so obviously you are dealing with, tell us about COVID-19 and your perspective right now before we end our talk.
So COVID-19 is, it's real. It's there. It's not going away soon. Social distancing, avoiding gatherings, wearing a mask when out in public, are all very important tools that we can do to help each other stay safe, and also help our healthcare workers and first responders stay safe and have rooms for the really sick ones. And, keeping in mind that, now the younger population is getting more affected, and sometimes more severely so. Just this past week on my shifts, we had a lot of the, 40s and 50s come in. Not so much of the 80s or 90s or 70s come in. So it's really important to know that, we're all susceptible. And in that, comorbidities like obesity, diabetes that's uncontrolled, high blood pressure that's uncontrolled. These are all very, very important risk factors that are, giving people very severe disease and a high mortality rate. So it's important to take this time to really manage those chronic illnesses to help, reduce our chances of having high mortality and, having our chance to survive this illness.
Great.
if
So
at
your
all we
tips are
can.
stay home as much as you can, wash your
Yeah.
hands, wear your mask, and cancel all social gatherings.
Yes.
Right? Okay.
Except if it's on Zoom or FaceTime
Exactly.
or
Exactly.
IG.
Awesome. Okay. Well, you guys, this was Dr. Sneha Kishore. She's a lifestyle medicine expert. You can learn more from her blog articles at argohealth.com. And thank you so much for coming on today. We really
Thank you
appreciate
so
you and
much.
all
It
of
was
your
a
work.
pleasure.
And thank you for helping all those COVID patients as well.
Thank you.
Thank you. Okay. Bye, guys. Bye, everyone.
Bye.
Bye, Sneha.
Bye.